Okay, guys, let's go ahead and get started and talk a little bit more marketing tips that I want to be able to share with you guys because these are some really golden stuff, right? So let's go ahead and get started with these marketing techniques. A little bit more items. We're getting deeper and deeper into this, right? So let's get started. Before you go out there, you want to be able to know what other people are doing, right? So you want to be able to look at their websites of other agencies to see what are they doing within their websites, what type of services they offer. Are they offering additional services that you're not even offering, that you maybe should add to your repertoire? Are you seeing how they deliver their talks, their speeches? Are they doing it through videos? Are they doing it through white papers? Are they giving it to articles? Are they writing blogs? They're creating vlogs? What are they doing to get their information out there? Other things that you should do is see how their pipeline works, right? Right? That's such an important look. It's okay to spy on people. It's okay to give a call and make a pretend query. The reason why you're doing that is you're trying to see what they're doing and if you can actually improve yours by seeing others. The best way to be able to improve yourself, the best way for you to learn, for you to be able to create success, is to be able to follow what successful people have done to create success for themselves. It's the easiest way to learn, right? If you see what other people are doing that have done that created success for them, you want to be able to mimic that. And at the very same time as improve and add more and tack onto those to make it even better and customize it towards you. Don't look at it as being a bad thing. Look at it as a good thing. I love teaching people what has helped me in my companies. The reason for that is that I know it's going to be able to generate success if it is applied properly. So it is okay to look at others. At the very same time as this is a great technique because you need to be able to see what is out there. And remember from past videos, you do not want to be competing. You want to be above them and go past them. So if you see what they are doing and you see that it's generating leads, but add more services, more products to what you're actually doing, right? Now, let's go ahead and talk about what the USP. And we're going to be talking about this actually designed because thinking about, let's say you get into an elevator, and in that elevator is that person you've been wanting to speak to for so long. Before the doors even open and they go on your way. So what you need to be able to do is to between that 15 days in company that you provide great care and that most physicians have enjoyed using your services, what you need to do is you need to be able to practice and generate a good elevator pitch. Elevator pitch. Let me ask you guys this, right? Do you have an elevator pitch right now? Can you tell me within 15 to 30 seconds before that door even opens, something about your company that's going to be able to generate my interest to start using you if I was a physician? If you don't even have one, create one. We can actually help you create one of these elevator pitches that has worked. We actually have a formula on how to be able to generate an elevator pitch. For me to be able to share that with you guys, I want to hear your elevator pitch. So if you want me to help you with your elevator pitch, I want you to send me a video of your elevator pitch, and I'm going to show you how to be able to improve it to make it even better. So for you to be able to get my help, create that video, send it to us, give us a call, and we're going to create that wonderful elevator pitch, okay? The next thing I want to be able to talk about is this. Are you actually following up? Are you actually looking into your conversion rates in regards to your referral sources? Are you actually watching to see that everyone that's referring to you, that they're actually being admitted? Remember, there's a difference between a referral and a full admission. You want to be able to see what those physicians are doing, because if you're starting to see that, or let's say, for example, a physician refers to you and you're not actually admitting the patients, maybe you need to go back to that physician and maybe give them more education, give them more, their staff more training, more information, so that you can show that you are a smart person, you're an educated person, and that you actually want their company to become successful at the same time as to take care of the patients. As a marketer, as a liaison, if you are, let's say, for example, managing a team of liaisons or marketers, you need to be able to make sure that on an average, this is an average, that they should be visiting between 45 to 65 referral sources in a weekly basis. Okay? Let me repeat that. 45 to 65. And that is literally the average. The average. For me, I want to make sure that we visit between 65 to 85 in a week. Can it be done? Yes. How can it be done? Planning, Google Maps, right? Looking at everything that you need to do. If you plan ahead of time, this will allow your team and for you to be able to actually visit and get more referral sources. Now, of course, out of all those people that you're visiting, some of those people are just being revisited, right? You've already went them before. You're creating that follow up. You're creating that you showing up every 7 to 10 days where they see your face. You using a great scheduling system or CRM, or using something like your secretary taking care of the notes, or you using your iPhone, you're going to be able to make sure that your team is visiting between 45 to 65. And even if they get better, if they start visiting 65 to 85, imagine what can happen. When I have a marketer, I always tell them, this is your high numbers. I expect you to visit 65 to 85 people within a week. By me telling them that, and if they all of a sudden fall short a little bit and hit 60, 65, they're still where I want them to be. But I want to encourage them and give them ideas, give them techniques on how to be able to manage their time, create a presentation in less than a few minutes to generate more leads. I'm going to teach them everything that they need, all the techniques, and help them with their time management, because ultimately, if they have great time management, they are going to be able to visit more referral sources and potentially open up more of them, which means more patient referrals and a higher census for our company, right? So these are just a few tips that you guys should actually be doing at this very moment. So let's cover the basics. Go and see what other people are doing, but at the same time is provide your team good training. Other than providing them good training, is give them some expectation and some goals, and make sure that you follow up that they're reaching those goals, making sure that they are actually visiting the places. And if you start doing that, you'll be surprised how your home health agency is going to start seeing an increase in more referrals. You have to demand this. This is necessary for your company to become successful. So hope this tip helps you guys out. If you guys have any more questions, don't forget to comment down below, ask us some questions, and always understand that home health marketing is easy when you know what you're doing.